Good day. The following presentation by my group members and I will address the area of child autism. My name is Giri, and in my capacity as the first presenter, I will provide an overview of autism and highlight its impact on the community. While the terms autism and autism spectrum disorder, abbreviated as ASD, are often used interchangeably, for the purposes of this presentation, the term ASD will be utilized when referring to the topic area. ASD is an umbrella term encompassing the following disorders: autistic disorder, Asperger's disorder, childhood disintegrative disorder, and pervasive development disorder. ASD is a lifelong developmental disability that is characterized by difficulties in social interaction, impaired communication, restricted and repetitive interests, as well as sensory sensitivities. Current estimates state that ASD affects 1 in every 100 children, with boys about 4.5 times more susceptible to the condition. Despite this prevalence, it is important to highlight that no two people with ASD are alike, as suggested by the term spectrum. Their challenges feature on a continuum. Even though each individual may face difficulties in communication, socialization, and flexibility of thought, they will present very differently from others due to the wide range of challenges they experience and the severity of the symptoms. Some of the common challenges that children with ASD experience include difficulties using eye contact, using and understanding gestures, sharing interests with others, using verbal language, engaging in symbolic or imaginative play, and understanding emotions in self and others. In addition, they could also present with impaired social skills, motor impairments, sensory sensitivities, delayed development of receptive and expressive language, echolalia, which is a repetition of words spoken to them, stereotyped behaviors, unusual preoccupations, narrow and intense interests, and a preference for routines. This myriad of features makes ASD a very complex condition to understand and diagnose. The complexity of understanding ASD is exacerbated by the fact that there are no known definitive causes for the condition. However, what we do know is that ASD is a very disabling and distressing condition that presents substantial challenges for the children affected, their families, and friends. While some of these challenges can be remediated via intervention therapies and structured support, ASD essentially is a lifelong condition with far-reaching impact on education, employment, and quality of life of both the affected children and their families and friends. Data from the Australian Bureau of Statistics indicate that 95% of children with ASD who attended school experienced restrictions, with 44% needing to attend either a special class in a mainstream school or a special school. 6% of children with ASD were not able to attend school at all because of their disability. This is a confronting statistic, given that school is an important social environment where children learn to interact with their peers, a task that is already a challenge for a child with ASD. Such restrictions and challenges continue after school as well, with 81% of people with ASD who finished school not completing a post-school qualification. In addition, it is estimated that in Australia, unemployment rates for individuals with ASD are around 65% compared with only about 6% for the whole population. This then has a ripple effect on the financial and economic security of people with ASD. Children with ASD need assistance with a range of activities, including speech and language, amongst other aspects of communication, as well as social, cognitive, and emotional tasks. As such, greater awareness and understanding of ASD, as well as early intervention to provide appropriate and adequate support for those dealing with the condition and its impact, are pertinent in our community today. I will now hand over to Narelle, who will expand on this presentation by discussing about the clinical practice guidelines for autism. Thank you.